Often, we see people wearing headphones with music blasting. Or sometimes, we have the TV turned up so loud, it gets so overwhelming. What we probably don't realize is that these are bad habits that can eventually cause damage to our hearing. Remember, our ears and our hearing need special care too. On today's program, we'll be talking about the health and care of our ears. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, your connection to healthcare. As an ENT surgeon, I know firsthand how complex the inner workings of our ears can be. ENTs are trained both in the medical and surgical treatment of ear infections, as well as hearing loss and even problems with balance. We have with us today Dr. Claydine Barrientos. She's a pediatric ENT specialist from the Makati Medical Center who also specializes in audiology, or expert sa mga problema ng pandinig. Our second ENT expert is Dr. MITZI CABE-DOMINGO. Before we can talk about ear health, let's talk about first how we can protect our ears, or some practical ways in order to protect our ears. I want to start off this discussion with Dr. Barrientos. First of all, Doktora, bakit ganito ang itsura ng mga tenga natin? Because if you'll notice, not everyone's ears are the same. Meron bang purpose ang mga kulubot sa tenga, or kung bakit ganito ang itsura ng mga tenga ng mga tao?
Well, Dr. Gomez, if you notice, the outer part of our ear is like a cup. And those corrugations are also there to help us be able to capture all of the sounds so that we can hear better, bring those sound waves into the ear so that the ear can bring it into the brain for better hearing.
I know a lot of people, a lot of Filipinos like to clean their ears with cotton buds or mga Q-tips. Parang hindi kumpleto ang pagligo ng isang tao kapag hindi nilinis ang tenga nila with cotton buds. Is this the right way to go in order to protect our ears or to clean our ears?
Actually, ear cleaning is not necessary. The ear is a self-cleaning mechanism, so we don't need to use cotton buds. We don't need to put cotton buds inside the ear canal. The earwax that is there will come out once the ear doesn't need it. And in actuality, some earwax should be left inside the ear because it helps protect the ear against dirt, against pollution, against dust, and it also has some antibiotic properties.
Use of cotton buds is not recommended. Now, another thing also is what is called the 60-60 rule. Dr. CABE-DOMINGO, can you explain to our viewers what this 60-60 rule is?
Have to have a limit to the sound exposure in our ears. And the recommended maximum limit would be 90 decibels. So this 60-60 rule was come up with to help minimize the wear and tear effect that chronic exposures to loud sounds can do to our ear. The 60-60 rule comprises a maximum of 60-minute exposure to sounds at a level not exceeding the 60% mark. So in our gadgets, you would see we have volume bars. So you shouldn't exceed that 60% mark.
You mentioned about loudness as well. I'm sure a lot of viewers are curious. Ano bang kino-considered na loud? Ano ba yung limit or on what can be considered as loud in order for us to probably avoid it in the future?
So the maximum limit would be around 90 decibels. And their effect can happen when you exceed that 90 decibel limit for at least 5 hours continuously 2 consecutive years.
We heard from Dr. MITZI on what is considered loud, or how we should protect our ears from loud sound. Is this very important, Dr. Barrientos, for those especially working in an environment where the audio levels fluctuate, probably mga construction workers or mga operators of heavy machinery? What should they do in order to protect their hearing? And is it really that important for our hearing to be protected in this kind of environment?
So protection of the ear against noise is very, very important in the working environment. Also for people who frequent like bars or concerts or enclosed areas with very loud sounds, you should protect your ears with either earmuffs or earplugs, so that the volume that comes from outside will be dampened medyo hihina siya once it enters your ear canal, and it won't cause damage to the nerve supply itself. Once they are out of that area, they should rest the ear for at least 16 hours so that the nerves can regenerate.
Okay, very important points. Now, very quickly, Dr. Mitzi, before we go into break, a lot of people also experience, especially pag umakit sila ng elevator or minsan pag sumasakay ng eroplano, sumisikip yung tenga nila. Why does this happen? And is there anything that the viewers can take in order to prevent this sort of feeling ng tightness in the ears?
This is what we call barotrauma. So this happens when there's an imbalance between the pressure of the middle ear and the outer environment. Generally, our ear is divided into three main parts so that you have your external, middle, and inner ear. And your middle ear has a connection to the back of your nose, and this connection is what we call the eustachian tube. So it's a narrow passageway which is lined with mucosa. And when you have problems with the contraction of the muscle around it, or when there's swelling of that mucosa, we do get difficulties in opening up the eustachian tube to help in equalizing this pressure. So we experience this barotrauma when there is a sudden change in the pressure outside of the ear.
Now we'll pause for a quick break, but when we return, we'll talk about hearing loss and its disorders. You're watching Med Talk Health Talk on CNN Philippines. Stay with us. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. Earlier, we talked about practical tips to protect your ears from possible damage. But there are other factors that can cause hearing loss too. On your screen, you'll see a few of them, namely genetic causes, there are some complications at birth, certain infectious diseases, chronic ear infections, or ito yung mga ear infections na pabalik-balik or paulit-ulit. Use of particular drugs, especially mga gamot na ginagamit for the treatment of tuberculosis, exposure to excessive noise, as well as aging. Now, I want to go to Dr. Barrientos and focus on one of these factors for hearing loss, namely aging. Is it normal, Dr. Barrientos, for someone who gets older to lose their hearing?
Yes, definitely. Losing hearing or hearing loss does come with age. There's what we call the disease presbycusis. So as one reaches the age of 45, 50, definitely they can't hear that well. So you would see the elderly patients always saying that they can hear but they cannot understand what they are hearing. So those are already signs of hearing loss for their age.
That is why you need to be very observant of your ear health. Now, Dr. Barrientos, you mentioned this a little bit, but could you explain further what are some of the symptoms that our viewers should be wary about that can be signs of their hearing being lost?
So there are certain words that you cannot understand what it really is. Tinnitus is one, or ringing of the ear. It usually always accompanies hearing loss. Definitely, if you have to increase the volume of the TV or of your audio phones when you are using them, then you may have difficulty hearing. In children, parents will usually notice that if they call the child and the child does not respond, it is a sign of hearing problems.
Okay. And to our viewers, if you're experiencing any of these signs and symptoms, please consult your doctor as soon as you can. Now, Doc MITZI, what is an ear infection and what are its signs and symptoms? Because often, people will associate probably pain with an infection. Automatic na ba yun, MITZI, na kapag sumakit ang tenga ng isang tao, infected na ito?
Okay, so ear infections can be caused by bacteria or viruses, and it can affect any of those three parts of your ears, which I mentioned earlier, external, middle, or inner ear. So usually, yes, patients would complain of ear pain. They can experience itchiness. They can have discharge coming out of the ear, hearing loss, tinnitus. They can also experience dizziness as well.
Okay, now another common ear problem is a ruptured eardrum. Now, Dr. Barrientos, can you explain to our viewers how a ruptured eardrum can occur? At ano ba talaga ang eardrum? Ano bang silbi nito sa tenga natin?
Well, the eardrum is very important to our ear because it is the structure that brings the sound waves into the ear so that it can be brought into the brain. So it is very important that it remains intact. It doesn't have any tear. So definitely a perforation or ruptured eardrum is usually caused by an infection due to the ear problems mentioned a while ago by Dr. CABE-DOMINGO. Also, it can be caused by trauma, like the use of cotton buds is one. If you do insert it too deeply inside the ear, it can cause a tear of the eardrum, or any foreign object that is placed into the ear, usually like matchsticks or the little spoons. They can cause a tear of that very important eardrum.
Now, as a follow-up question, Dr. Barrientos, if a patient wants to consult this, malalaman ba ng ENT on the first visit of the patient kung butas na yung eardrum ito or may rupture or may perforation ng kanyang eardrum?
By the use of the otoscope, it is an instrument that we use to be able to see the middle ear, specifically the eardrum. So your ENT doctor will be able to see immediately once you go to the clinic if your eardrum is intact or if meron siyang butas.
Also, this symptom that maybe a lot of people feel but they're not really sure of it, ito yung ugong o yung pag may ringing silang naririnig sa kanilang tenga even though na walang sound sa environment nita. And this is often called tinnitus or tinnitus. What is this and how is this different from other causes, probable causes of ear infections or ear problems?
Tinnitus, as we mentioned earlier, is ringing of the ear. So you feel, you hear a ringing or a hissing in the ear. It's very disturbing to the patient. You usually will hear it, especially if you are in a quiet environment. Now, tinnitus is a symptom. It's not a disease entity. It can be caused by a lot of problems in the ear. So if you do have any ringing in the ear, then definitely it should be checked to see if you have hearing problems.
All of these symptoms, for that matter, can also be caused by excessive earwax or cerumen. Now, don't be mistaken, earwax is normal and healthy, as was mentioned earlier. It's part of your immune system and even has antibacterial properties. But if too much earwax builds up and becomes hard, it can block the ear. Now, this is sometimes often common. Dr. MITZI, what are some of the main causes kung bakit nagbe-build up ang earwax sa isang tenga to the point na it affects the hearing?
The common practice is to do ear cleaning usually after every bath. And the tendency when you use cotton buds is you actually push the earwax back inside the ear canal. So that's when a buildup occurs. It can also happen if just naturally the patient produces earwax a lot more than the usual. So to address this common misconception on frequently cleaning the ears, we should understand that our earwax is not actually dirt. So yes, like you mentioned, it does have antibacterial, antifungal properties which help keep our ears healthy. We have impacted cerumen. We address that by flushing it out, or doing ear suctioning, or extracting it.
And all of those procedures mentioned by Doc MITZI should be done by a trained specialist or a trained doctor, such as an ENT. Please do not try those procedures at home. Still ahead on the show, we'll talk about the right treatment for hearing loss. Keep it right here on Med Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and we want to be your partner for a lifetime of good health. A buzzing sound or a ringing sound can sometimes be a sign of hearing problems. And for others, it's having a hard time understanding words in normal conversation. When you experience any of these, please go see your doctor, such as an ENT, for them to do a proper ear examination. Dr. MITZI, what are some of the tests doctors will run in order to diagnose hearing loss? Could you explain some of these tests?
Okay, so the basic way to diagnose is, of course, with the medical history of the patient. We also do a physical examination. And part of the physical examination of the ear is by doing otoscopy. So this is the direct visualization of the external ear by using an otoscope. And we also request for hearing tests.
Once someone is diagnosed with hearing loss, what is the usual treatment or where do they go from here?
Once we diagnose hearing loss, if it is caused by an infection, then definitely the infection has to be treated. Now, if the hearing loss is caused by a nerve problem, what we call the sensory neural hearing loss, then what we can offer patients are hearing aids. So these are helpful tools that will be able to help them hear better.
No, that's a good thing that you mentioned that, Dr. Barrientos, because a lot of people may be unsure of what the benefit of a hearing aid is. Is it that simple for someone to merely buy a hearing aid, probably from a store or from abroad maybe, put it in their ear and then okay na yung pandinig nila?
Well, no. Hearing aids need to really be fitted to each patient. So you can't share hearing aids. You can't buy a hearing aid and just suddenly use it. Because the problem with hearing is there are different frequencies or different pitches. So there's high sound, there's low sound, there's medium sound. And each of that area has a different hearing level of loss. So we need to find that out with the hearing test. And the hearing aid needs to be fitted to exactly what your hearing loss level is. So you can't just buy one and use it. It's not going to be helpful because it may cause some feedback and you won't be able to use it because you will have a lot of discomfort.
And as I mentioned earlier, the first step in order for a healthy ear is a clean ear. Now let's go back to that. Paano nga ba talaga ang tamang paglinis ng tenga, or how should our viewers maintain the cleanliness of their ear?
Well, the ear is a self-cleaning mechanism, so it will clean itself. What we only have to do is, when you take a bath, that ear will already be clean. You just pat dry the outside of the ear with your washcloth or with your towel. Always remember you have to keep that ear dry. So pat it dry. Don't put anything inside the ear canal. Don't put the cotton bud inside the ear canal. You can use it just for the outer concavities, but definitely don't put it into the canal. That is the only proper way of cleaning the ear.
Now I'll go to Dr. MITZI. Meron bang mga pagkain na dapat iwasan or mga pagkain na dapat kainin para magandang health ng ear?
To help keep our ears healthy, it's best that we keep it dry as much as possible and do the proper ear cleaning techniques like what Dr. Barrientos mentioned. Don't expose your ears to very loud sounds for a long period of time as well. A simple act also to help equalize the pressure is by doing frequent yawning, swallowing, and chewing as well.
Okay, we can't say it enough. A clean ear means a healthy ear. With that, we'd like to thank our guests for today, ENT specialists Dr. Clydie Barrientos and Dr. MITZI CABE-DOMINGO. I'm Dr. Freddy Gomez, and on MedTalk Health Talk, we bring you the knowledge and care you need, especially in this time of COVID-19. We'll see you again next time. Stay safe and be well.